Smoking refers to the act of inhaling and exhaling the smoke of tobacco or other substances, most commonly from cigarettes. The primary addictive substance in tobacco is nicotine, which leads to dependence and various health problems. Nicotine has various physiological effects on the body due to its action as a stimulant, primarily impacting the central nervous system and cardiovascular system. These effects can vary depending on the amount of nicotine consumed and the frequency of use. Physiological effects of nicotine central nervous system, CNS, effects, increased alertness. Nicotine stimulates the release of neurotransmitters like dopamine and norepinephrine, enhancing alertness and cognitive function. Pleasure and reward. Nicotine increases dopamine levels in the brain's reward pathway, creating feelings of pleasure, which contribute to addiction. Reduced anxiety. It can temporarily reduce feelings of stress and anxiety, which is one reason people smoke for relaxation. Dependence and tolerance. Over time, repeated use causes the brain to require more nicotine to achieve the same effects, leading to addiction and tolerance. A cardiovascular system. Increased heart rate and blood pressure. Nicotine stimulates the release of adrenaline, epinephrine, which leads to an increased heart rate and constriction of blood vessels, raising blood pressure. Vasoconstriction. The narrowing of blood vessels decreases blood flow, which can strain the heart and increase the risk of heart disease. Increased risk of heart disease. Chronic nicotine use increases the risk of heart attacks, stroke, and other cardiovascular problems due to the strain it places on the heart and blood vessels. Respiratory system. Bronchoconstriction. Nicotine can cause constriction of the airways, making breathing more difficult, especially in individuals with asthma or respiratory conditions. Metabolism and digestive system. Increased metabolic rate. Nicotine temporarily boosts metabolism, causing the body to burn calories fast. Decreased appetite. Nicotine suppresses appetite, which may lead to weight loss in smokers. Endocrine system. Insulin resistance. Nicotine can interfere with the body's ability to regulate blood sugar, potentially increasing the risk of developing type 2 diabetes. Increased cortisol levels. Nicotine triggers the release of cortisol, a stress hormone, which can contribute to various long-term health issues like high blood pressure and weakened immune response. Gastrointestinal system. Increased acid production. Nicotine stimulates acid production in the stomach, which can lead to gastritis or worsen conditions like acid reflux. Decreased gastrointestinal motility. Nicotine can slow down digestion, causing issues like constipation. Muscular effects. Skeletal muscle stimulation. Nicotine can initially cause slight muscle stimulation, but dependence on smoking nicotine is a highly addictive stimulant that affects the brain by releasing dopamine, a neurotransmitter associated with pleasure and reward. Over time, regular smokers develop a dependence, meaning they need nicotine to feel normal and experience cravings when they go without it. Physical dependence. Nicotine stimulates the brain's reward pathways, creating a cycle of cravings. Psychological dependence. Many smokers associate smoking with certain behaviors or feelings, such as stress relief, making it harder to quit. Withdrawal symptoms. When a person stops smoking, their body goes through nicotine withdrawal. Common symptoms include irritability, anxiety, and mood swings, difficulty concentrating, increased appetite and weight gain, restlessness, and trouble sleeping. Cravings for nicotine. Depressed mood. Treatment for smoking dependence. Nicotine replacement therapy, NRT. NRT helps to reduce withdrawal symptoms by providing small, controlled amounts of nicotine without the harmful effects of smoking. Forms of NRT includes nicotine patches, nicotine gum, nicotine lozenges, nicotine nasal sprays, or inhalers. Medications. Certain medications can help reduce cravings and withdrawal symptoms, such as bupropion, Zyvae, an antidepressant that helps reduce nicotine cravings and withdrawal. Varenicline, Chantix, reduces the pleasurable effects of smoking and curbs cravings. Behavioral therapy, counseling and support groups can help individuals develop coping strategies to resist triggers and maintain long-term abstinence from smoking. Cognitive behavioral therapy, CBT, helps people identify negative thought patterns and replace them with healthier behaviors. Support systems, peer support groups, hotlines, and apps that track progress and provide encouragement can aid in quitting. Alternative approaches, mindfulness techniques, relaxation exercises, and physical activities like yoga or walking can also help manage withdrawal symptoms. Smoking cessation is a challenging process, but with the right combination of therapies and support, long-term success is possible.